Welcome to the American Association of Critical Care Nurses Voices in Nursing podcast, exploring critical care nursing through meaningful and inspiring conversations. This episode is sponsored by the award-winning quarterly journal AACN's Advanced Critical Care, with information available at www.aacn.org/advancedcc. Now, here are your hosts, AACN's Chief Clinical Officer, Dr. Vicki Good, and Clinical Practice Specialist, Andrea Schmidt.
Welcome to the Voices in Nursing, a podcast by AACN designed to amplify the voices and perspectives that matter most to nurses across acute and critical care. I'm Dr. Vicki Good, AACN's Chief Clinical Officer. Today's conversation is going to focus on a condition that every nurse encounters and one that demands constant vigilance: sepsis. It's often called a silent threat, but is a life-threatening response to an infection that can rapidly progress to organ failure and death if not recognized early and treated. In the United States alone, more than 1.7 million people develop sepsis each year, and at least 350,000 die as a result, making it one of the leading causes of mortality in healthcare. For direct care nurses, this isn't abstract, it's an everyday practice. That's why awareness, education, and teamwork are critical, and that's why today's guest brings an important perspective. Today, we're joined by Sara McMannus from the Sepsis Alliance, the nation's leading organization dedicated to saving lives and reducing suffering through sepsis, education, advocacy, and collaboration. Sara is a longtime friend of mine. I've known her for numerous years, so I'm super excited to welcome Sara. So let's get started with a few introductions. I know you well, but I want you to tell us a little bit about yourself and your nursing career.
Thanks, Vicki, and it's so good to just have the conversation with you and to be back in touch. So I did graduate from the University of Iowa, and it's now 50 years as of this year. So it's kind of amazing how the time goes by.
Wow.
Initially, I started working in critical care and did bedside nursing in North Central Iowa. And then a few years I did staff development and PACU. So from there, I went into work with the medical device company, GE Healthcare, where I continued to take my critical care skills and experience and do education through monitoring and our various global resources and services that we had. And from there, I retired in 2017 and became more involved with Sepsis Alliance. I'd known and been part of the organization for numerous years, and it just made sense that when I had time for preferment or discernment in retirement, I work for something that I really truly believed in. And so I've been the clinical advisor for Sepsis Alliance since 2017. And as many of us in healthcare, professionally, I've seen patients that have experienced sepsis, and many of those patients didn't have to progress to septic shock and sometimes death or life-altering changes. So from that perspective, sepsis improvement in care is especially important. And personally, my brother, almost 36 years ago, actually had meningitis and sepsis and died at age 33.
Oh, wow.
So that was, very much of a it didn't have to happen.
Right. So it gives you a personal connection to your work.
Yep. And even more recently, my husband had bacterial pneumonia and sepsis. Luckily for him, he did get prompt treatment and appropriate treatment. And he only ended up spending 10 days on the medical floor. But even that, he did experience the complications with altered kidney, liver labs,
Right.
and then, impact on respiratory system, thyroid, heart, cognitive, even with just sepsis. And so consequently, that is another personal, and there's more, and I
Right.
think many nurses have experienced it both professionally and personally.
Roughly a third of Americans have even heard the word sepsis, despite that it being such a life-threatening emergency. So, talk to us about what is the overall goal and mission of the Sepsis Alliance?
So when Dr. Carl Flatley founded the organization in 2004, he did it after his daughter, Erin, had passed away in 2002 from an infection following a hemorrhoidectomy and sepsis. And he was an endodontist, and as such, he'd never heard the word sepsis. So clearly, there was not much out there in 2004. And he founded it as the American Sepsis Alliance, and then it was changed in 2007 to Sepsis Alliance. And his mission, really, in his life since that happening, was really to educate the public and healthcare professionals so
Hmm.
that there were no more errands. And
Right.
as we know, since that time, unfortunately, there have been many more errands and patients, families that have been affected by sepsis that didn't have to be.
Right.
So his mission really was one of education to prevent death and mortality and morbidity. So with that, that's the sole mission. Now, at first, it was really the community.
Hmm.
And the very first survey that was done of public awareness was actually in 2004. And at that point, only 19% of the public had heard the word sepsis.
Wow.
Whereas fast forward to today, in 2025, the last survey, it was up to 75% had heard the word, which is great. But there's still so much opportunity because knowing the word is one thing, but knowing the symptoms and when to seek help is a whole nother challenge. And in 2024, I believe, was the last time they asked the question, can you identify the top four symptoms of sepsis? And only 15% could.
Hmm.
So the public still more work to be done there. Partway through the journey, it was discovered that, well, if the public knew and they presented to the hospital, then healthcare professionals need to be on game to be
Right.
able to address it. And since that time, I think we in healthcare have come a long ways. We've got more we can improve upon, but for the most part, people are a little more focused, a lot more focused
Right.
probably in their protocols and nurse-driven protocols, and we really have come a long way. But I think to the idea that we're almost coming full circle, that now, in my opinion, this is just strictly Sara McMannus, her opinion,
Yes.
um, it is time that we go back to the community and the public, because if people don't get to the hospital in a timely fashion, then no matter how good we are in the hospital setting, it's like the patients fall over the edge, and it's so
Right.
difficult to bring them back after that point. So I think we need to focus once again on the community and knowledge.
Yeah, because I mean, a lot of times when you get an infection, you just think it's part of the healing process, and you might dismiss symptoms. So talk about the It's About Time initiative that the Sepsis Alliance initiated.
Yeah, and I think that really ties in really well with our previous question in that that's taking it to the next level. Everybody in the public know on heart, stroke. So really the goal was to have sepsis become similar so that everybody knows when you have time is important, time is critical for sepsis. You have temperature for T for temperature, and it's either high or low. And then I for infection, signs of infection. M is mental decline. It could be confusion, sleepiness, difficult to make sense. Maybe for an older person, they're just not the same. It may not be dramatic, but they're just not the same. And then E is for extremely ill. Oftentimes you'll hear people say, I felt like I was going to die. It's difficulty breathing, it's pain, extreme pain. So with that kind of mnemonic, then it becomes something that's common, and you think time. And it's a reminder that if you are having any of those concerns and you seek medical help, you can say, have you considered sepsis? Or I'm concerned about sepsis. And that to me just raises that kind of a flag. Put that in your kind of, if you're doing a diagnosis, just to consider it.
Right. Which I think that it helped tremendously, that same type setup for strokes, because now people can, rattle off what the top symptoms are that they should be looking for. I know you all have done a lot of work with bringing family and caregivers, into your program. So how do you use patients and families in your advocacy and awareness efforts?
Yeah, I mean, I think having, the families, the patients, the survivors, the public that's had to deal with sepsis is so key on so many levels. It's really having the voice of what they experienced to share amongst themselves for support. It's also a way to translate to us as nurses what the experience is, to better understand that, and then to take it to that next level as to how can we improve in our care? What things could we do differently, not only for the patient, but their family? And at what stages of their experience with sepsis can we intervene and have more impact? So is it pre-seeking care? Is it at the time of admission for the emergency room? Is it during the hospitalization? Transitions of care, even within the hospital setting, from maybe ICU to the step down to the floor, transitions home. Then looking at also hospital readmissions. Is that a point of time where we can do better when they're discharged to have follow-up calls or some sort of a protocol to catch people when they're starting to decline so they don't have to be rehospitalized? You can catch it early with reinfections or whatever the case may be.
Well, and I know when I was at the bedside, I'd often, if I saw something in a patient, I'd often look at the family and say, is this normal for them? Because I don't know what normal for them is. And so if they are having a decline in, their mental state or, something like that, that I don't have baseline knowledge of, the family becomes an incredible advocate at that point that we need to take advantage of.
For sure. And they become, part of the care team, ideally. The other aspect, I think, where patients, families, et cetera, play a part is even in research. As the researchers are doing in legislature, policy, all of those voices of patients and their families can have influence on those.
Right. So I know you all have had many different phases of sepsis, throughout these years. Is there one story that stands out more than another?
Yeah, I mean, the Faces of Sepsis platform is just amazing as you delve into it. Right now, there's more than 2,000 Faces of Sepsis stories.
Oh, wow.
And it's incredible how each of them bring out different areas, whether it's like when they're first coming down with an infection and perhaps the beginning of sepsis, to during the process of whole experience, whether it be hospitalization or whatever the sequence of events for that person is, and then follow up. So there are so many components of every story that are just amazing. And I've read through many of them, and it always ceases to amaze me how you think you've heard it all, but there's
Right.
just so many nuggets of learning in each one. So I have a couple of excerpts from Nia's story. And again, throughout this story, there's different little key components that are takeaways, I think. On a cold winter day in December of 2012, I found my life quickly dwindling before my eyes. I had been sick for a while with a pesky cold that wasn't going away and was worsening over time, not realizing that it had turned into pneumonia. I had never been sick quite like this, but being a teenager, I hoped that it would somehow resolve itself with over-the-counter medicine, as I had no context for what I was experiencing. I remained proactive as any kid trying to attend to an odd illness could be, but eventually I began to deteriorate. On December 10th, I attended my internship, although I felt extremely off. Within 5 minutes of being there, I was shaking. My body was so cold that I felt as though I had been locked in a freezer, only I could feel. The pain and chills radiated deep in my bones. I'll never forget the way my teeth chattered so hard that I was terrified they'd break. I shook in a near cartoonish manner, the way animated characters express that they're cold on children's shows. My body was no longer in control. I rushed home at that moment and quickly hopped into bed, turning the space heater on to warm myself. Less than an hour later, I felt my body burning and looked up in horror to realize the space heater was never actually on, and something was horribly wrong. I would later learn that I had 106-degree fever. I can't really explain how I was able to go the whole night without medical treatment while having actively worsening sepsis, but I did. I'll never forget on the ER admission, them trying to take my heart rate and looking up at my mother to say with terror in their eyes, I can't hear anything. So quickly, I was sent to the ER. I remember the pain, trying to breathe, and instantly having my breath hit against a wall. Being virtually unable to walk, the pain of suffering deeply and potently, no human should. By the time I'd gotten to the first hospital, I had learned my body was rapidly shut down. My kidneys had already failed, and my body was close to bottoming out. I had full-blown septic shock. This led to me being rushed to a second, more intensive hospital where I'd end up with multiple doctors and teams, various tubes within me, a PICC line, multiple nerves being hit in arms through IV attempts, scars and an inability to breathe, and a solid realization that my young life was likely about to be cut short. In recent years, I've learned to advocate for sepsis awareness and to make a point to show others that this is something that needs to be taken seriously. To survive sepsis, not just in the moment, but also the years after is huge and should not be overlooked. Post-sepsis syndrome is something I also had to work on, understanding, as I had no idea that the experience I had after my septic shock were in fact related. I stand here today grateful to have survived late-stage septic shock and pneumonia. I now work to make sure others are able to detect sepsis as early as possible so that it never progresses as far to its final stage. So I think that story is one from 2012. And yet, for anyone seeing that the NASCAR driver Kyle Busch passed away just in 2026,
Right.
similar story, he did not get the same outcome, unfortunately. It was tragic that that outcome happened. So it's just, something that continues, and we have to unrelentlessly just continue the battle.
Well, and I think so many people think it's a disease of older patients. And it's not. I mean, it's young people, it's old people, it's all people. There's not one group that this focuses on. It's universal to every single person.
That's for sure. And granted, the people at highest risk are the very young and the very old and
Right.
those with chronic conditions, but everything in between, is also a risk if you have infection, untreated, and then your body just cannot sustain that and basically goes into overdrive. And, you mentioned earlier some of the misconceptions. One of the big ones is sepsis is an infection. And I
Right.
think, we can dispel myths. Sepsis is not an infection. It is the body's reaction to an infection. So, and then recently, I heard somebody more public facing say that pneumonia, they did not know pneumonia was an infection.
Right.
So there's a lot of little nuances that, we as probably in healthcare don't realize that the public has thoughts and they need to be guided.
Right. Well, and health literacy is a major issue. And it's not limited. I think a lot of people think, oh, health literacy is only for uneducated people. But, many of my family friends who are highly educated people, the minute you give them any kind of healthcare information, they're overwhelmed. They don't understand because we use different terminology and they don't understand all this. So let's flip it a little bit and talk about the healthcare team. And Sepsis Alliance really suggests a collaboration or a collaborative approach to this. I mean, it takes all of us. It takes the EMS, teams that are picking these patients up. It's the ER, it's the educators, it's everyone working together. So how does Sepsis Alliance approach all the different healthcare professions that need to be working in unison on this problem?
Yeah, I mean, definitely it's all hands on deck. And, it's every healthcare professional that touches
Mm-hmm.
the sepsis patient and their families. So in a lot of our education that we have, we try to bring together the physician, the nurse, the pharmacist, the social worker. So it truly becomes everybody that does interact with the patient. Not to say every course that we have is that way, but we do try to really look at the team approach. And Sepsis Alliance Institute now hosts more than 220 courses, and the credit available for most is nursing contact hours. And last year we added CME, so that now courses that fit will have CME as well to try to gather up the physician component for that. So ideally, and we have courses that are strictly EMS.
Mm-hmm.
So truly at every point that you mention of interaction with the patient, we try to really look at bringing those all together.
And those courses are free, right? To
Yes.
anyone that wants to go on your website and take them.
Yes, correct. And that's one of the things that I think is so amazing with Sepsis Alliance is all of the materials, whether it be what you can go online and print or patients with information, sepsis and pneumonia, sepsis and urinary tract infection. The list goes on. How do you feel after sepsis? A caregiver's guide. All those materials are online available at no charge.
Yeah, which is incredible. And then you all host Unite for Sepsis Symposium every year. Tell me a little bit about that. What does it look like? What do you talk about?
Yeah, that is incredible. Our second year just happened recently, and I was lucky enough to be able to be there. And it was really bringing together all people that are concerned with improving sepsis care, from researchers to clinicians, physicians, nurses, pharmacy, to legislators, to policy. One panel had CDC, NIH, every government organization on the same panel talking to each other, answering questions from the audience about sepsis-related measures and legislative actions, et cetera. So it's really trying to do what the symposium is called, Unite for
Mm-hmm.
sepsis. Previous to that actual symposia, we did a day on the Hill, which I was fortunate to attend as well. And there we went to, the group I was with actually went to 3 senators' offices and 1 House of Representatives. And through that, we were able to, the first question was, have you heard of sepsis? And remarkably, this year, I think more have than usual.
Right.
Some more in detail than others, but then just talking through either our personal experiences or for some, the experiences they had with their family members and or friends. So really it was about raising awareness, because if all the players, be it research, legislative, clinical, if we're
Right.
not on the same page, we aren't able to move things forward in the most effective, efficient, best way for patient care to improve.
Right. And you've got to have that alignment between policy, practice, research. It's all got to be in lockstep together. So,
Yes. And I think to add the patient voice
yes.
goes throughout all of that.
Yeah.
And we were very fortunate to have the patient voice there as well, with many survivors there telling their stories. And, in addition, one of the focuses that came out of this symposia was the need to really look at post-sepsis
Mm-hmm.
care. One of the panels was from Michigan, and they talked about the costs that they see occurring in post-sepsis. And I think that's another area that we can look at more, and hearing from all the people together that helps us know these things
Right.
and really focus. We always knew post-sepsis was a challenge, but we really, I think it's becoming more evident of the size of the challenge, not just personally to the individuals involved, but also to costs.
Right. Right. Which is, we have to look at both. I mean, there's the human cost and there's the, you know, physical, financial cost as well, that we have to balance both of those. for sure. Want to talk a little bit selfishly, but we did, AACN did put out a micro credential on sepsis just to help to validate nurses' knowledge. And so nurses could go out and say, I have this baseline knowledge on this disease process. So I understand you recently took it and just wanted to hear a little bit about your experience in taking it.
Yeah, I mean, when I heard that you were doing that, I was so excited because for me, it's a focus. It becomes important, which we
Mhm.
always felt like it was. And so having the micro credential, like you mentioned, it validates much of the knowledge that's already there. It's saying, yes,
Right.
I have that knowledge. And more so, even it's for the nurses that are yet to get that knowledge and experience, they seek to learn to do the micro credential.
Right.
I found for me personally, it was difficult because I hadn't been at the bedside and it very clinically in-depth and focused and comprehensive. I did pass, but it was
Yay.
narrow margin. But the other piece that I love about it is that it's, correct me if I'm wrong, but I believe it's a licensed professional that
Correct.
can take
So
it.
it's open to anyone. Yeah.
Yes, which I love because it goes back to the interdisciplinary
Right.
team approach, which I think if one could get everybody that's a licensed professional that's caring for patients with the micro credential, everybody's at
Right.
a level playing field. You know what the other person knows and what they don't know necessarily, but you're all together. So
Right.
I would love to see, and maybe hospitals have done this or units where everybody on the unit can take it.
Right. Yeah. And that's the important aspect is, while we like to think that, a nurse can do everything, we can't. And it takes the entire team working together, to do these. So finally, looking ahead, what's next for Sepsis Alliance?
There's so much work to be done in so little time. It's just thinking through even our brief discussion here.
Right.
Community. What can we do to improve education of the community? Um, the pre-emergency care, whether it be urgent care, primary care, then there's the emergency responders,
Right.
then there's the whole ED throughout the hospital stay, discharge, and then following up, and then maintaining that person in their healthy state in the near weeks to months afterwards so they don't get readmitted. So, it's hard to prioritize. Then there's the research aspect and legislation aspect. So there's so many things. It's hard to really zero in on any one of them. Some of the actionable things that I think could be done near term, kind of a light to medium lift, would be, and having been a member of AACN for I think now probably 40 years plus, always involved in the local chapters. I look at some of the local chapters and think, is there opportunity for local chapters to do
Mhm.
like a community outreach? And it could be something as community only focused
Right.
through maybe a community senior center, or even like thinking children, there's probably opportunity there, something with the schools. Or you could even go to services such as EMS in their community or nursing homes or, some other
Mhm.
route, but do some education as a chapter project. And
Right.
Sepsis Alliance actually has a already pre-canned, if you will, program called Sepsis 911 that has slides, a quiz, a post, and you could use any portion of that to take that as a AACN local chapter and take that education out to community as a project. So
Right.
that's something I've been thinking would be kind of a cool way to do that. We have every year Sepsis Awareness Month, which is in September, which is a big focus. This year, I think it's 15 years of Sepsis
Wow.
Awareness Month. And so with that, during the month, lots of activities. Maybe it's a time hospitals could have a table, even in their atrium or cafeteria, where people could have community education materials, again,
Right.
focusing on educating the public on sepsis. For the nurses and other healthcare professionals, the Sepsis Alliance Summit takes place September 16th to 17th. Again, a free conference online with always amazing speakers.
Yeah.
Latest what's happening. So, I mean, there's so many things, short term and thinking longer term. You know, for myself, I learned a lot about our legislature. Shamefully, it wasn't something that I was really that familiar with.
Right.
So kind of my goal for myself personally is looking at what else can I do to educate them, and looking at what things can we do as a country to move things forward, with having funding. One of our big asks on the Hill Day was to ask for $5 million as a start to have some clinical kind of a trial or trial states, I should say, that would look at data. And with cancer, we made so many strides having the cancer registry. So
Right.
doing just a very trial basis with 3+ states to see if we could do something similar with a sepsis registry to collect data. Because again, to move the needle forward, we need to understand more about people that get sepsis, about how the treatments, you know, and all the nuances. We're not probably going to find there's just one flavor. I think that research has been shown that there are different instances, and then the instances of sepsis dictate treatments. You don't give
Right.
one treatment to a person that, you know, will not respond, and so forth.
Yes.
So I think that's another opportunity.
Yeah, that individualized care has got to be there.
Mhm.
Well, Sarah, I just want to thank you not only for doing this podcast, but for your incredible dedication to the nursing profession for numerous years. You've been an advocate for nursing, you've been an advocate for patients, and you know, I just hope I'm half the nurse that you are when, you know, as I sunset into my career at some point in time, because you've just done so many great things during your preferment, as we like to call it. So thank you for all the work you've done. And thank you for taking time out today to spend some time with us to educate our audience on sepsis more.
Well, I appreciate all of your kind comments, and you as an individual, and of course AACN as an organization. It's as you know, very near and dear to my heart.
Well, you're near and dear to us as well. And I just want to thank our listeners. We appreciate you for joining us on this episode. We would love your feedback on this episode and ideas for future episodes at podcasts@aacn.org.
Thank you for listening to the American Association of Critical Care Nurses Voices in Nursing podcast, proudly sponsored by AACN's award-winning quarterly journal, AACN's Advanced Critical Care, with information available at www.aacn.org/advancedcc.